I'm Dr. Karen Leong, and I'm here with one of my patients who recently had a breast reduction done. This is a procedure that she's been thinking about for quite a long time, and she's young. She was only 25 when she had this done, and she's been gracious enough to agree to share a little bit about her experience. And funnily enough, she wrote an essay, so I'm just going to let her read her essay, and then we'll do a little question and answer session after that.
Okay, so like Dr. Leong said, I thought about this procedure for years, and it always seemed so far-fetched. So the factor of price, pain, and the questions of, do I really need this? Is it really necessary? Can I just accept my body for what it is? So I always felt really disproportioned. I'm only 5'2", and they always, my chest always made me feel and look larger than I actually was. Even in middle school, I wore 2 sports bras in an effort to keep them from growing anymore, and because that was the only way I would feel comfortable playing sports. And they never went away, even with weight loss. So early on in my teen years, I gave up swimming, gymnastics, and basketball because I just felt so uncomfortable. And don't get me wrong, I know there are plenty of women who have succeeded despite having a large chest, but I just didn't feel like it was worth it or comfortable for me. So now I'm in my mid-20s, and I kept thinking, why am I spending my youth being so consciously upset about my body and letting it limit me? So I decided to just take the first step and just go in for a consultation, not expecting to go through with it anytime soon. And I'm so glad I did, because that first meeting with Dr. Leong put me at ease and really paved a way I didn't think was going to be possible in such a short amount of time. And I finally feel so comfortable in my own body. I finally feel like myself. I'm ready to get back into the sports I gave up. And no, I'm definitely not in the best shape of my life, but I feel more capable now that that barrier is no longer a factor in my life.
Thank you for sharing that. I think it's very meaningful to hear, the experience and also kind of the thought process that led into seeking the consultation and then undergoing the procedure. So a couple of things I just wanted to have you answer for us. How old were you when you first started developing breast tissue?
I want to say, I want to say around 10 or 11.
Okay.
So
when did you get your period?
I was in 7th grade. I remember it was the first day of 7th grade.
Oh, that's fun.
I believe that was 11.
Okay.
11 and a half.
Okay. And how old were you when you started feeling like they were too big?
8th grade, so I was 13.
Oh, so pretty soon after you started developing them, they grew pretty quickly.
They grew really quickly, and I noticed I was larger than everyone else, and no one else really wore bras or sports bras at the time, so I felt very different.
Yeah, very self-conscious about that. Okay, and then so at the time that you and I met, what size bra were you wearing then?
I was 36 double D, and they were already kind of spilling over.
Yeah. Because I had a chance to meet your mom, and she's little itty bitty.
Yes.
So he said, where did this come from? And unfortunately, you were blessed with more than most. Okay. And then just couple of questions going through the procedure, because everyone always likes to ask, how did you feel the day of surgery? How did you feel during the recovery in the first couple of days after? Anything you would recommend to people thinking about doing this?
It honestly went by so fast. It was such a blur. The day of, I thought I would be way more nervous than I was. I was just ready to go in and get it over with, because in my head I was thinking I would get there, I'd fall asleep, I'd wake up, done. Recovery was not as bad as I thought at all in any way. It was a very dull pain, if anything. I'd compare it to when I got my wisdom teeth taken out. It wasn't painful, it was just a dull, aching pain. And the first few days, again, mostly a blur. They went by so quickly. I think I was asleep most of the time. Yeah.
And what would you, is this a procedure you would recommend to others? And if so, what kind of guidance can you give them when they're starting to think about doing this?
Absolutely. If you're thinking about it and have thought about it for a long time, I think at the very least you could do for yourself is go in for a consultation. And at that point, you can decide for yourself, just so you have all the details and you understand the process and how it looks for you, and the price, see if it's worth it for you to go through with. I think the first step, just to go in for a consultation, and you made it so easy because you never pressured me into anything I didn't want to do. It was really there for me to get information. And I'm so glad I took that step.
Yeah, we are too. Now, I think people, whenever they're trying to think of breast reduction, it's hard to picture how you might look with smaller breasts. So how did you go about that process, trying to figure out how big you wanted to be or how small, and were you kind of tending towards make me as small as possible or leave me something a little bit to work with?
So it's funny because I'm really good at Photoshop, and I remember standing in front of the mirror, and I would take that photo and I would kind of just edit it just to kind of get an idea of what I would look like, of what they would look like, and that really convinced me to go in, and
I think maybe we should engage your services for other patients. That's fantastic. There was a program where they were doing that body simulation during consultations, and you should think about that.
It's really cool. It's nice to get a visual because you can think about it
and see it on yourself. It's different looking at other people's pictures than it is to see it on your own body.
Exactly.
Yeah. So what's the first thing you bought for yourself afterwards?
Oh, a bralette. I've never worn a bralette in my life. I bought a bralette and I could never wear it because they were just, it was so uncomfortable. There's no support. So I bought a bralette and I have one today.
Well, thank you for sharing with us. Thank you for your essay. That was actually very meaningful. I really appreciate it. But we're glad you're happy. And again, thank you for sharing your thoughts with us.